In this video, we will discuss two common diabetes medications known as semaglutide and tirzepatide. These drugs are used for the treatment of type 2 diabetes. We will explore the similarities and differences between these drugs to help you better understand how they work. Before we delve into the specifics of semaglutide and tirzepatide, it's essential to understand what diabetes is. Diabetes is a chronic condition that affects how your body processes glucose or sugar. There are two primary types of diabetes, type 1 and type 2 diabetes. Type 1 diabetes typically begins in childhood and is caused by the immune system attacking the pancreas. Type 2 diabetes is more common and usually occurs in adulthood. It develops when your body becomes resistant to insulin, the hormone that regulates blood sugar levels. Semaglutide is a medication that belongs to a class of drugs known as glucagon-like peptide 1, GLP-1, receptor agonists. It is used to regulate blood sugar levels in people with type 2 diabetes and helps to reduce the risk of cardiovascular disease. Semaglutide works by stimulating the pancreas to produce more insulin and reducing the amount of glucose produced by the liver. It also slows down the movement of food through the digestive system, which helps to reduce appetite and promote weight loss. Tirzepatide is also a medication used to treat type 2 diabetes. It belongs to a class of drugs known as glucose-dependent insulinotropic polypeptide, GIP, and GLP-1 receptor agonists. It works similarly to semaglutide by stimulating the pancreas to produce more insulin and reducing glucose production in the liver. Tirzepatide also helps to reduce appetite and promote weight loss by slowing down digestion. Common side effects of semaglutide and tirzepatide include nausea, vomiting, and diarrhea. These side effects usually subside after a few weeks of use. Additionally, both semaglutide and tirzepatide have been found to increase the risk of developing thyroid tumors, although the risk is still very low. In conclusion, semaglutide and tirzepatide are two common medications used to treat type 2 diabetes. Both drugs work by stimulating the pancreas to produce more insulin, reducing glucose production in the liver, slowing down digestion, and promoting weight loss. Although they share many similarities, they also have some differences. Talk with your healthcare provider to find out which medication is the right choice for you.